approval of the DR. So I guess if we're going to skip the approval of the May minutes, that takes us to the education work group members. And so looks like we're going to hand it over to Catherine for this section. A little update on the education work group.
Yeah, so we met last week as our first meeting, and we really tried to focus our time on going through the issues and talking through the issues that we want to prioritize first. I think we have some follow-up to do on that still. For those on the work group, we're going to be recording the meetings in case we have to miss because of summer break and vacations and those kinds of things. But I think we're in a really good place to get this work going. We had Jane Cooper join us from JSIP, and so that's really exciting because she actually has had education as one of the things in the back of her mind for a while. So we'll get that connection with the juvenile courts. And we talked about doing some either bench cards, trainings, and that's all stuff that she can help us with. So I think we're in a good place to start. If anybody wants to add in anything from folks that were there at the meeting, I'd love to have you add in.
We also set our follow-up meetings. I believe we're going to be meeting I think we've set once monthly, correct me if I'm wrong, but we're going to be doing it every Tuesday following the commission meeting. And so not meeting tomorrow, I believe, because we just met, but we're setting it monthly for starting after that. I thought it was a great meeting as well. We went over what our previous educational recommendations were, tried to prioritize them a little bit and talk about what the next steps that we need to do as a commission. Another role of that, or another topic that came up that I thought was interesting was really kind of inquiring about what our actual role on that is, how much of that is us doing lobbying or just sharing it with the governor's office and proposing for them. And so that's stuff that we'll meet with Rachel as we continue to move forward and really gauge what our role in pushing, how to push it forward best is as advocates. Um, so yeah, anybody else want to add anything from that commission meeting or from the educational work group meeting? Okay. Well, we'll be meeting next month, the day after the commission meeting. Ellen, do you have the DRO report that you could share? Or not I'm sorry, the
Yeah,
support
I
letter.
do. I have the letter. And I did put a note in the chat of our excused absences for today because we do have a couple of people that are out and away. So I wanted to make sure that we get that noted for the minutes. But I'll pull up that DRO letter right now.
So as Ellen's pulling that up, just a little bit of a reminder on the context of that. Earlier this year, the Disability Rights Oregon report came out, and we reviewed that as a commission. It made several recommendations, similar to the Special Masters report we read last year and kind of supported their recommendations. We, as a commission, had begun drafting the support letter, and then Ellen shared it and kind of got feedback from everybody on it. From my perspective, I hope everybody's had a chance to kind of review this and put their thoughts into it. When I was giving feedback on this, my feeling was, we don't need to kind of go line by line and say, yeah, here's this recommendation, here's this recommendation. I felt that this letter should kind of hit on our theme, which is, we've continuously supported certain themes throughout all of the Disability Rights Oregon recommendations and the Special Masters, which we tried to kind of summarize here. No matter what we've been doing as a commission, we've always advocated for investing in Oregon, for keeping our kids here, and for doing everything we can for kids here rather than sending them out of state, all of that kind of stuff. And so what we wanted to do with this letter was really kind of capture like, look, we support this because it fits the theme of what we've been supporting as a commission, which is invest in Oregon, invest in the structure here, invest in our kids here. Um, has everybody reviewed this? Any thoughts?
Uh, if I may speak without being called on. I've just reviewed it, and one thing I think that maybe we should speak about is also like talking about early childhood uh sort of social support programs for foster youth, like a greater focus on that. Because we have to remember that a kid's environment is a big, it's a big factor in their opportunity and socioeconomic mobility later in life. And while obviously the work that we do is limited to youth under 18, if I remember correctly, or under 21, we can still at least be recommending stuff like maybe protecting the preschool for all program, for example, in Multnomah County, which I think would be useful for foster youth. And I think maybe we should be talking about like what about more programs to help foster youth be able to integrate into the workforce later on with early sort of program starts that provide them the skills and stuff like that. So I think that just slightly elaborating on that might be a good uh, sort of option, especially since those are two of my big focuses, making sure that early in life that kids have access to that, and especially foster youth, because there are some foster youth who, of course, go there when they are infants, and I myself, I did not go in foster youth as that young, but preschool provided by the San Diego, California Affirmative Action Program was super important in helping me reach where I am today. And I think that's going to be true for a lot of foster youth. So there's that. And then, of course, we need to ensure that foster youth, when they age out, are being provided tools to get to be able to have upwards mobility in life and be able to be fulfilled, live fulfilling and healthy lives. So yeah, that's that. I would only make like a couple slight edits. So I
Dean,
don't think that's necessarily, that we should necessarily like talk about specific programs, but so that's about it.
so Dean, just for clarity, are you saying that that should be included in this response to the Disability Rights Oregon thing, or is that something that that you're interested the commission working on, perhaps through like the Education Work Committee, since it's preschool for all?
I think that it might make sense to just like have one or two words mentioning it here, just as like our in the letter to the governor, so to showcase that we do support that. And of course, I am interested in working on that on the education subcommittee as well. So,
Hi, this is Alex. I would like to pop in and also say that I was incredibly disappointed as a Multnomah County voter, the way that the preschool for all situation went down, and would love to be very vocal and advocate for that, and work on anything involving that, and send anything forward to the governor's office regarding that.
Any other thoughts on this?
Just as a note, since we've spent quite a bit of time over the last month on this particular letter, specifically addressing the DRO report that everybody weighed in on, what I'm wondering is if, especially with preschool issues and which seems really well placed for our education committee because we've got a lot to take on there. And maybe that becomes a separate and new thing since that's not a part of the letter we're responding to. Um, we, because my understanding was today you were wanting to approve this. But we can always put it off too and make changes, whatever you all decide.
Well, we can't approve it because we don't have.
Oh, we don't have it. We don't have a quorum. That's right. We can't approve it today anyway, so we'll just stop with that.
Yeah, one of the reasons that we were interested in sending this out is we did share with the governor's office kind of, a lot of the feedback that we got from commissioners this year, which is it was a bit frustrating the process that happened this year, which is, it felt like we kind of got brought in when the bill was already created and we weren't really engaged prior to it. We've had that conversation with everybody, but part of getting this letter out sooner than later is letting the governor know before next legislative session what, the things that we're recommending. And so while it's not super time sensitive for today or tomorrow, getting this letter out, is something that we hope to be able to get to. Just so the rest of the commission knows, we do have a standing monthly meeting with Rachel. So we are communicating with the governor's office. They are taking into consideration all the feedback that we had. I know it's been a while since we've met, but we had a great meeting with the governor's office. I think Anna may have been there. I know Michelle was there. And sometimes it feels like, the governor's office may not be hearing everything we're saying, but that was a meeting that was really awesome from my perspective because they showed us in kind of the amendments that they were proposing, which was really taking into account everything this commission had said. So I think Michelle or somebody made the comment of like, we are listening, we're just not doing a great job communicating it all the time. So, it's important to know that I think they are listening to these letters, and the quicker we can get them out is helpful for them to hear what we're proposing. From my perspective, I agree that, the preschool for all issue is super important. I don't know if it fits in this DRO response letter for clarity, but I'll default to the majority of the commission as well.
I do just want to note that I am again not asking for like any major changes, just like a couple slight edits, like one or two extra words or something like that. That's all. So because I do recognize the need for urgency in this situation.
Dean, could you send some model language of like what you'd want to throw in there? It doesn't have to be like right now, but we're not approving the letter. We don't have quorum. But if you
Yeah,
could
yeah,
send it
sure.
to Ellen.
I'll do that. It should be easy to tack on. So
And then Ellen, correct me if I'm wrong, but we can't vote via email because it's not a
Right.
public.
What we did was just have everybody, what we were doing was having everybody just say sign off and hey, that we're good with it. That's fine if they just do it directly to me. And so Dean, if you have any language, just send it to me. Don't send it to everybody on the commission. Just make sure you just send it to me and you can just send a paragraph in an email, that you would like to see.
yeah, I'm hoping it'll be less than a paragraph, hopefully even less than a sentence.
Okay, just something like that. You can just send it to me in an email, but the important thing is not to be having, a meeting via email. So, but I'm going to stop sharing this now, but everybody has a copy of it. So if you would like to just take a look at it, if there's anything you want to add, since we're not in a huge rush, what we had decided rather, we had most everybody weigh in and say individually, yeah, I'm good with it. But we'll wait till we can have an actual vote next meeting, probably is the thing. I think that was what we decided, Casey, that we wanted to do it as an actual vote, right? So we'll
Yeah.
just wait till next meeting.
And the thing to add is, even though this letter's getting a bit delayed getting out, it's nice that Rachel's attending all of our meetings, and so she's very well aware of where our commission stands on this. So even though we may not have a formal letter out yet, I know the governor's office knows where we stand. And I saw Rachel, I think she hopped on. Yep, she hopped on. So welcome. All right.
Thank you. Nice to be here.
I think we can move on if nobody else has any comments. Did Pamela or Jesse, you have any comments on it, or Malik?
No, I had provided some feedback in the edits the last round we did. I don't see a natural place for this stuff around preschool and early education to fit in here, but I trust Dean to follow up and get us some language that would fit. Otherwise, I'm good.
I can look you in if you would like, Pamela.
Okay. I'm stuck on the screen, so I'm not sure where the next agenda item is, Ellen.
Certain thing, my buttons on my computer, I click them, but they're not being as responsive as normal. So
I got it pulled up. So we're moving over to an update from the governor's office, and we'll hand it over to Rachel if she's ready.
Sure, I'd be happy to. Hello, everyone. Rachel Kearns Henry here. It's nice to see you all. Thank you for your work. I want to start off and give, just want to make sure I just start off directly, Casey, to your note. Listening and meeting with all of you and understanding where you are in your policy recommendations is very important. We absolutely view the expertise that you bring as part of that, that goes into our decision making as we think about how we develop budget recommendations, for example. How do we help to weigh in on policy matters before the legislature, and then looking as well at our public administration priorities as we look at where do we need to improve operations and accountability in our systems. So thank you for your work. I want to start off with giving some budget updates in context, and this does fits nicely, I think, with the letter that you have here. And I want to just acknowledge that really early on, as part of our budget making development process, how the budget process works is we develop recommendations for the governor's recommended budget. Those recommendations are then put forward, and then the legislature debates that legislation between January and June, and then comes up with the final budget. And youth behavioral health and investments that we had within the Oregon Health Authority and the Department of Human Services for building capacity and for residential capacity and building youth behavioral health, essentially more capacity, and ensuring that we had some of the creative options that were identified in the special master's report were part of our budget strategies. And I'm happy to report today to all of you, we were successful at getting those budget recommendations passed in a very challenging budget environment. The budget environment that we had, for the first time in many, many years, what happens is that the legislature gets a forecast, and you have a certain amount of money that you have, and you got to figure out how do you adjust your budget box. And very late in this budget process, the legislature received a forecast that basically said, you have less money than you need to, so you're going to have hard choices. And even with those hard choices that we made, the youth behavioral health investments that we advanced to help build residential treatment capacity, $10 million at Oregon Health Authority to help do co-occurring mental health and substance use investments, that passed. Our investments for intensive behavioral health treatment model, that's a step-down model, IIBHT, expanding that model to also make sure that we can include substance use diagnosis in that modality. That investment also advanced. Our expansion of school-based mental health access and making sure that we had operational dollars to ensure school-based mental health continued, making sure that we were looking at historical federal dollars that were ending for suicide prevention work that needed to continue, and making sure that we were focusing on the important suicide prevention work and culturally specific activities. Those investments continued. We're really excited. That's all new money that continues within OHA for our youth behavioral health capacity. Those are all the items that you're noting that are in your letter in terms of what we're trying to build. We also advanced a $10 million pool of funds within DHS. And what we stated in that pool of funds was that it needed to be flexible enough to be able to implement some of the recommendations from the special master's report, to be able to try new models that we needed to have. The legislature gave us that full $10 million with our ability to implement that work. That is very exciting, and just something I want to make sure that you are hearing. On the DHS side, in addition to that temporary lodging investment pool, we also received a $7 million allocation to make sure that we could continue doing Family First Prevention Service funding ask. So making sure that the work that we've done, that this group has talked about, where we talk about the family therapy, kinship navigation, the peer supports work, that funding needed to be matched with state dollars in order to continue, because the federal government was phasing out their 100% match. We've maintained that so we can continue doing those critical services within DHS. That is something I want to highlight. And additionally, We also have additional investments. And I see Jesse here on the call. Jesse, I remember you came and presented in some of the work. Like the work that you do, that's what is being funded with
I
this
know
new
that's all.
part.
I just seen that. I was like, yes, thank God,
Yeah.
thank God.
Yeah.
Nice to hear. Thanks
So
for
I just wanted to make sure you knew that. So that's great. We also maintained a $20 million investment for youth experiencing homelessness. The reason why this is important to highlight is because it was a one-time investment in 23-25. It was a one-time funding that we had to build up this programming and to start having an infrastructure for our homeless youth. And our priority was not to go backwards. We needed to maintain that $20 million. Now, there were other bills, and Michelle can speak to, there was lots of requests to expand that, to grow that population. Unfortunately, we weren't able to grow beyond that 20 million, but we were able to maintain the budget that we had for the $20 million allocation. And that is why at the end of the day that passed, and we were that's a good thing for Oregon's youth and for our provider community who serve those youth as well. We had some payment increases as well for our independent living program, making sure that those older youth who are transitioning out of of essentially child welfare, aging out. How do we make sure that we're having positions that will help to maximize access to social supplemental security, SSI benefits to improve financial stability, making sure that we had some money as well for provider payments as well for that program. Those are some highlights. We didn't get the full amount we asked, but we got some, and the legislature did make those decisions. Let me just see if there's anything else I want to highlight on the budget side. So I'm stating that just in overall context. Many of our other, oh yes, there's two areas I want to highlight that where we disagreed with the legislature, and I think it's really important that you have for your awareness for the future policy making. The governor's recommended budget stated in our what was called our base budget, our current service level budget, we stated and made the policy assumption that rate increases for foster parents should be ongoing, and that should be something that we continue to have as cost of living adjustments occur, and that we should be making sure that policy change to have a rate increases should not just be one time, but they should be ongoing. And so we built into our budget that we would continue to have rate increases to support our foster parents and being able to maintain access to quality placements. Unfortunately, the legislature said, we disagree, we're pulling back that money, and they did not include assumptions that we would have rate increases for our foster parents. That's something we'll have to take back and think about and understand, well, what should that rate methodology be, and why do we have that disagreement, and what does this mean going forward? How do we monitor those rates with access? Those are some considerations we'll just have to put a plug in and think about, put a pin in and come back to. I do want to also mention, though, that the BRS program, the Behavior Rehab Services Program, those rate increases are built into that model. Those built-in rate increases did pass, and I'm just giving that as an example of those kind of underlying budget assumptions that are really important to understand so we can think about what's the pool of funding that we have and how are we allocating those funds. So those are two other provisions. I would love to dig in and come back with all of you, and we can continue to dig into our policy bill that didn't pass, HB 3835. I know you had questions on, and there were questions about, especially with like, well, why are we making certain choices? There's questions about why we were looking at out-of-state access and treatment. And what I want you to hear is that we absolutely, the governor has always been committed to building capacity and making sure that we're building what we need. But we also have to ensure that we are providing medically necessary treatment to kids. and that we cannot deny care. If we are unable to provide and have the medical infrastructure in the state to provide someone the care that they need, we think it is fundamentally unfair and against Medicaid law to somehow say that a child could not have the same access to care in an out of state just because you're in the child welfare program than you would if you were my child, if from or any of your kids who might have private insurance, or if you're another kid who has Oregon Health Plan, who is but just is not in the child welfare system, also has access to those benefits. So we were very much trying to make sure that we were identifying the distinction. There's a difference in our minds and in the legal language in terms of what is a placement versus how do you ensure that someone is getting medically necessary treatment needs that you have. And that has always been the intent of making sure that we didn't have to be in situations where the Department of Human Services had to break the law to provide medically access necessary treatment for kids so that they wouldn't die. That's ultimately what we want to make sure that they do. And sometimes our rules are set up in a place where we are putting DHS in that position to be sued, to break the law, to get them treatment. And that's the disconnect in the regulatory bill, example, that we were trying to remedy. Additionally, to the goals that I just mentioned, in terms of the financial investments, the reason why we were advocating again for the licensing changes that we were doing is because we knew, and what we know from the research, from what the SOCAC has led over the past years since they've been in existence, is we needed to understand what is the system, what is the environment. Money alone is not going to build us the provider capacity that we need. I need to be really clear there. Money alone will not do it. We have to have the combination of money, like in financial investments. We need to have training. We need to have the regulatory environment. We need to have the right licensing structures. We need to have the right rules. It has to be the entire ecosystem to help bring the system into balance. And that was the intention, is to support the behavioral health investments that we were doing in our in the governor's legislative efforts of those regulatory changes, was to help us to get to that place so we can build the capacity that we need so that we don't have to send anybody out of state, that we can build what we need in the state of Oregon first and foremost. But we need to make sure that we are having thinking about what is the reality of the situation that we're in, and just practically speaking, the current situation of where we have data that kids are not getting access, where we're losing providers. We need to make changes and help build and grow the providers that we need in the state. And that's part of those efforts and why we were advancing that. And we can talk about some of that further. There's more work to do. We're not done. We know that in order to be successful, we need to think about what worked and what didn't, what were the concerns of the policy changes, and advance that and continue to assess how we advance that further. But I want to make sure that it's clear about our why, and try to make sure that from our seat's perspective, help to explain why, in order to meet the goals that you've asked of us, build capacity, invest in these areas, we're saying, yes, we will put the money there, but we also need the policy changes to help make sure we're successful. And that's the balance that we're trying to get to. And that's what I hope, Casey, that we could continue to work through and identify. How do we make sure that there's balance, and that ultimately we need to make sure that the voice of the council and perspectives for safety and kids and consumers are absolutely heard. And we need to make sure that we look and identify where have we had unintended consequences, and we need to make some refinements so we can make sure that we have a system that's functioning. That's the balance that we're trying to navigate and grow in the future. So that was much of the debate that you heard this legislative cycle. And again, in summary, we succeeded on the funding. We weren't successful at passing the SOCAC bill. But we were successful in advancing a discussion and having what I think for the first time in many years was an active policy discussion with many different systems, making sure that both behavioral health leaders and judicial system leaders and education leaders and human services leaders were all at the table understanding how the policies are connected in an important way so that we can help to improve care ultimately. That's my kind of update on the state budget side and kind of some of our priority legislation. And Michelle and Anna will be able to, we can dig into some of the detailed questions as well. But I do want to make sure in my report that I'm also giving you some updates about what's coming and what else we're working on, which is monitoring the federal legislation and impacts and how we're thinking of what's happening in Oregon. So many of you have likely been reading the news and have seen that there's changes coming as we think about HR 1, sometimes referred to as the Big Beautiful Bill, that you've heard that is making changes to Medicaid and SNAP. First, I want to make sure that you all have a formal invitation, and we'll put it in the chat, to the community partner call that OHA and DHS are holding tomorrow. Both the Oregon Health Authority and the Department of Human Services teams will be providing some presentations about where we are in terms of analysis and looking at some of the impacts. I just want to surprise, we're not in this call tomorrow saying, here's a solution. We are helping to explain where we are in the process. And I think that's really important for people to know. In terms of the process, the governor has directed an enterprise review of each agency to look at the timelines for what are some of the impacts for the bill and what are the timelines for when those impacts would go into effect. So we're putting this together at an enterprise level. We'll be assessing what types of, what tables will we be setting and what will be led by the legislature, the governor's office, the different agencies, because we will be thinking through what's to come, and we're not doing it in a vacuum. It will need engagement and process from many. As you can imagine, these are very big funding implications that are coming for the state, and we're going to have to plan to assess what's next. Why does that matter for foster care kids? Just to make sure I'm being really clear and candid, all of the Medicaid benefits are how we pay for healthcare for foster care kids, right? So if you are in the system, if you're in Title IV-E, you are also then getting your benefits paid for through the Medicaid program, which is part of what has been we're having policy changes that will be changing the amount of federal money that comes to the state that we're going to be able to use to pay providers, to cover people, to look at eligibility criteria, et cetera. No decisions yet in how we're going to be adjusting for those policy changes, for those budget changes, but I want to make sure it's clear that that partnership and Medicaid is the financing vehicle for much of the work that we need to do within for the foster care and child welfare population. There's also some, so I don't want to, I could dig in on some of the policy details, but I'm not going to today because I want to encourage you to continue to go through to those community partner calls. And because we're not here to, for today to start digging into solutions, but to make sure that you know that this is the long road ahead that we have here. And we need to be thinking about what our timelines are. We're phasing in, how and when we're going to be making broader decisions. There's other work that for the governor right now is prioritizing looking at the transportation shortfalls that have occurred with the legislative cycle. You may have also been reading about those. The fact is that we're navigating layoffs because we have a shortfall in transportation. So we need to get through transportation fixes first, and then we'll be really assessing where we go from here in terms of looking at the health and human services funding challenges that we're going to have ahead and how we're going to approach those. So that'll be the work to come in terms of big picture budget guidance. We also have really important planning work. And what I want to make sure that we we need to continue to build the vision and identify what is it that we want Oregon's system to look like and build our pathways towards building that vision. You're doing that work with your strategic planning. Anna's doing some of that work with her strategic planning at the System of Care Advisory Committee. We have state legislative bills that will have really important policy changes and clarifications that Michelle's going to speak to. That is really important work to help just improve the day-to-day lives. And I encourage us all to continue to lean in and identify what can we control right now that we can control, that we can help to influence, because there's a lot that's here, and we will deal together with the federal budget changes ahead. But at this point, we're focusing first on what we can and what we need to with some of the next steps that we need to do from the state legislative session. And I think with that, I've tried to then tee up Michelle successfully to be able to speak to some of that work. But I see I have a question first.
Yes, thanks, Rachel. Do you have a link for those meetings that I could share with everyone, or we could put it in the chat?
Yep, I'll find that. It's on the should be on the DHS website. I'll find that. We can send that. I'll do that as soon as I'm done fielding questions.
Okay, that's fine. I just wanted to make sure, like you said, something with OHA and DHS. I just whatever, as many of them as there are, that I could publicize it. So depending on people's schedules, they could for sure make it.
Sounds great.
Hi, this is Alex. I just wanted to chime in. I thank you for all those updates. I do just want to add how I think the amount of trust that a lot of folks have had in this administration after the Preschool for All situation happened, the way that that went down, the meeting right before the vote, like not only as a former educator and as a child welfare worker, the way that this is going to negatively impact children, but to do it in the way that it was held in this current political climate to go against of the voters was just like really alarming to me in a lot of different ways. And I know that I'm not the only person that feels that way. I know that that is a large amount of Portland voters specifically feel that way. And it feels hard to sort of take a lot of what is being said right now seriously after that happened. I don't know if the office is aware of the way that the community feels about the way that that vote went down.
So Alex, I want to note, I'm not the lead for preschool to all and early childhood education, so I can't speak to the details. But what I can speak to in terms of representing the governor and being part of that team, working with the governor, what I want to make sure the governor feels very strongly and supports preschool for all. What the governor asked and was navigating is stating we need to have a sustainable funding mechanism. And how can we help develop that so we can help to ensure we have sustainable funding mechanisms so that we can continue to maintain and have preschool for all? I'm not prepared to get into the nuance and the details. I know that you have disagreement on that, but I think the governor felt very strongly that in order to help that we need to do both. Like we have to, sometimes the governor will lean into hard things and say where we need to make improvements and changes so that we can make sure that we have more access for all people. And this is an area where that is her intention of leaning in here, was to ensure that we have a sustainable system.
Yeah, just to go against the majority of voters feels pretty alarming, again, in a democracy, but okay.
Ian?
Yes, Dean Salazar here. You might have already heard, I already did talk of the PFA, Preschool for All situation. But beyond that, I actually wanted to ask you specifically, Rachel, regarding are there any at the moment plans by the governor to really be looking at ways to ensure that like young early childhood youth who are in foster care, I provided the tools that they need to be able to have a socioeconomic boost early in life, as well as programs that help them uh, before they age out of the foster care program. I've mentioned this briefly before in the meetings. You might have overheard part of that. So those are two things that I think that we should be focusing on, because we need to make sure that foster youth are fully thriving and being fulfilled. And I am very happy to hear about the school-based mental health program thing, since that's something I've been fighting for a long time. So I'm really grateful for that. That said, now we can move on to ensuring that they have the ability to thrive fully. And so I wanted to know if there are just any discussions at the governor's office or plans to push stuff like that or to reinforce stuff like that so that foster youth are able to be fully prepared and equipped. Because when I was in the foster care program as a youth, it was sort of like a choose one of these programs or you're sort of out, sort of, and not much before you're close to aging out. So I wanted to ask you what has changed and what the governor's office and stuff are currently thinking about and considering for the future to reinforce that in a robust and, of course, fiscally responsible and effective manner.
So I thank you for your questions and for your feedback. I'm glad to hear that just this, like, how can we help to focus on quality improvement and that intersection, thinking about improvements for early childhood, thinking about and childcare access, thinking about improvements as we transition out of foster care. I think that is the work that I know this group has been really working on and looking at. I know that you've helped champion some past pilots with Anthony Circle and some other areas that we're looking at. How do we help to improve school educational outcomes? You've been looking at data to do that. I don't have details off the top of my head right here of like, are there any specific early childhood efforts that are targeted for foster care youth? I don't know, and I don't know if we have that. What I do know is that what we have been really looking at is we do have certain, we need to ensure that um, uh, I'll just pause and say I'm not sure, but making sure that we look at how do we give, if somebody needs access to childcare, if they need access, and they are understanding what are the barriers, what's the financial situation, how where things are with the Division of Early Learning and Child Care in terms of care in terms of access. I mean, that's the partnership that DHS and DELC need to work together on. They work to make sure that we are prioritizing those individuals that are served through DHS and making sure that we are getting access to those child care supports, and having that partnership is very critical. I can't speak to any specific efforts beyond that. Michelle might.
I just wanted to suggest potentially having the Department of Early Learning and Care come. DELC is maybe more commonly known as. There was legislation passed in 2023 prioritizing children in the foster care system as well as those at risk of entering foster care with childcare, and getting an update from DELC on those efforts and kind of the wait list and challenges, I think would be helpful for this group. And I don't, it's not necessarily held by DHS, so I don't think I can speak to any of that, but having that group report on that might be helpful, and kind of how recent issues may impact that or not, or federal policy. I don't know how any of that, but DELC would probably be the one to respond. In terms of, I think I heard also about like ILP type services. I think it would also be great to have the ILP team come and talk about all of the work that's underway to equip our young people as they are exiting foster care, all the initiatives that are going on. I know there's one bill that we have got past the session that I'm going to talk about that is hopefully helping in some of that endeavor as well. So hopefully, I just think like those are big conversations, and maybe having separate meetings about those would be worthy for this committee.
Well, thank you, Rachel, for coming and giving us an update today. I know that, it's, we're not always meeting eye to eye, but we appreciate you coming and appreciate you sharing your context and the positions there and then listening to what we have to say. As we were getting your update, Judge Jaco joined us. So hi, Judge Jaco. Before we do the next one, which is the legislative wrap up, if we wouldn't mind if we could go back and approve on the approval of the May minutes, since we now have quorum. And so real quick, I'd entertain a motion for the approval of the May minutes.
I'll make a motion.
Was that Deanne?
It was me and someone else.
Okay, and is there a second?
I'll second. That's Judge Jaco.
Any discussion or changes? Okay, with that, all in favor of approving the May minutes?
Aye.
Aye.
Any opposed? Any abstentions? Okay, thank you. Quick discussion. It's 12:27. We're currently scheduled to do the legislative wrap up at 12:30, but we do have quorum. I know that there was some recommended changes from Deanne on the support letter on the DRO. Is that something that the commissioners would like to bring back next month, or do we want to go ahead and do a vote at this time?
I wouldn't mind voting now just to preemptively approve with whatever language Dean inserts around early childhood.
I'll second that motion.
Okay. So we have a motion and a second to approve the support letter on the recommendations for the DRO report. Any discussion?
I am late to this conversation. I apologize. Where are Dean's recommendations?
So they're not included, Judge Jaco. He had a lot of, and I can let you jump in here if I miss it, Deanne, but he wanted to add some stuff about preschool for all. I think there was some discussion about whether that's appropriate in this response letter or more appropriate for the educational work group. What I'm hearing Pamela say is she wants to go ahead and preemptively approve it, although we're open to hearing the language that Dean would like to have included. He said it's just a sentence or two. And so I believe he's going to send that out as well, or send it to
not just PFA, but specific things regarding like early childhood I'm just general comments regarding early childhood learning, and of course socioeconomic mobility programs. Same sort of questions I sort of asked Rachel. So just like slightly added language there as well.
And so, Pamela, what I'm hearing is that we're preemptively supporting being sent off to the governor, but we're open to hearing the language that Dean might propose. Okay. Any other discussion before we move to a vote on that?
So the vote would be that we're moving to approve the current proposed version that everybody got, and then potentially changing it if we hear Dean's language and somebody makes another motion to add that, or...
Yeah, I'm not sure how to do that second part. I think if it's substantially changed from what it is, we should bring it back to the commission. I think if it's just minor language that doesn't substantially change it, we might be able to move forward with it. But I think that's kind of where we are.
Okay.
He'd be sending the language to me. I'd be inserting it. He said it was about just adding a sentence. So I think we were thinking that adding a sentence within would be fine, but as Casey was saying, if it's substantial, then I can, once he sends it to me, I can certainly send something out to everybody letting me know.
Yeah.
Okay. Any other discussion? Okay. So all in favor of preemptively supporting the letter on the recommendations regarding the DRO support, say aye or raise your hand.
Aye.
Aye.
Any opposed?
Aye.
All right. Any opposed? And any abstentions? Okay, I think that passed 6-0. All right, we'll move to the legislative update. Michelle has joined us to get that.
Yeah, so I'm just going to go through some of the key bills that were passed that impact child welfare from this last session. The first one, I'm going to pop them in the chat so you all can kind of follow along or take note. Senate Bill 135 requires there to be an invite sent to a CASA representative for every CERT that we do. The CERT is a critical incident review team. Primarily, those are cases in which there has been a child fatality, when the child has been known to the agency either through a screening report or CPS assessment or was in our care. It's an interesting legislative change because this does not require that a CASA have been a part of the case, right? So many of our certs are not about child welfare custody youth. They are about youth who we maybe had a screening report on within the past 12 months that may not even be related to the incident in which or the circumstances surrounding the child's death. So CASA representation, we did get in the legislature for it to not be required, but for it to be, and we are supposed to send out the invitation for CASA representation, but we don't have to have it's upon them, right? If they can't accommodate coming to the CERT, we can still proceed with the CERT assessment and not have undue delay. It's going to be an interesting dynamic. I will say, kind of from my personal feeling, it like made a lot more sense if it was about a youth in foster care in which there would be a CASA component. But this is going to be an interesting experience to see how that goes. I believe that process has already started to figure out how to extend the invites and have participation, and we hope to have some learning from that. In general, there is going to be some efforts by ODHS to have conversations with the legislature on the CERT criteria and CERT process, as well as what Oregon has opted in to do, which is a safe systems analysis with all of these near fatalities or fatalities. And really understand, does our statute align with the scope and intent of what a CERT is for, and the system learning that needs to be done. There's a lot of work happening at the national level, some recommendations that are coming from a child safety organization on kind of best practices coming up. So we look forward to that conversation in the 2027 session. It's not a short session conversation, but happy to answer questions or keep you all up to date on any of those efforts. But that is a bill impacting CERTs that was passed and is being implemented. Senate Bill 1016 really is just a bill that reinforces that ODHS is to use appropriate carriers for the transportation of children that are experiencing carrying custody of child welfare, to have their personal possessions transported in an appropriate carrier. We specifically advocated not just for luggage, because there are some items that could be transported in a different type of carrier. Like if you have a bunch of books, it's easier to carry in a box or a plastic tote than it is to put in maybe a luggage carrier. And so we have some kind of exceptions around that, and we are working on kind of three main communications on that bill. One is a poster for DHS offices to have as a reminder of the need for appropriate carriers to be used. Communication to office managers that are currently responsible for tracking inventory of appropriate carriers, as well as ordering new ones as needed, so that they make sure that they have a clear definition and some examples of what appropriate carriers are. And then lastly is a communication to resource parents. This is of note. So last year, 2024, the last data that I heard was of that year, there was about 17,000 total moves of children in our system. And of those, we had 17 times in which a trash bag was used. Now, that doesn't mean that a trash bag was the only type of carrier. Maybe it was to put a comforter or pillows or something that was difficult to put into a luggage carrier or beyond what the caseworkers had at the time. But the biggest or the most significant piece of data we gathered from that is that the vast majority of those times, I think it was all but around 3 to 5, were resource parents bringing children's items to a DHS office, unbeknownst to the child, but using a trash bag. And we still counted those, we still reported those. Even if it isn't a DHS action, we are being very diligent in making sure that it is clear that this is something we take very seriously as a dignity issue. And even if a child's not aware of it, even if it's not a DHS staff's action, that we're talking about it, addressing it. And so we're doing a communication to resource parents to make it clear to them as well, that trash bags are not to be used. If they need an appropriate carrier, we are happy to supply them with whatever they need. But that communication hasn't been as deliberate up to this point, and so we're trying to figure out how to send that out and also integrate that into some of the certification training and awareness. So we hope to see if that communication is successful and seeing drops in those numbers, right? Whether it's part of the benefit of doing the data tracking, to see how successful some of these efforts are. But those are some key efforts that are going to be coming before the end of the year on 10/16. Senate Bill 944 is one that these two concepts were part of our omnibus bill, which was the System of Care Advisory Council bill. The first one is around making more flexibility that youth did not always have to pay for some of their ILP housing. We had many or multiple youth that were not in circumstances that they could acquire an income to be able to pay a portion of their housing expenses. We internally recognized that. We started this policy change without a statutory change just to be able to remove that barrier for some ILP youth to get access to these services. And then this was a step to get it in statute that it didn't have to be a requirement for kids to have to pay a portion of their housing, because that's not always realistic for some of our kids. The other part of 944 was part of our System of Care Advisory Council bill, but the legislature adjusted the language a bit that was not what we had envisioned within DHS. And that is around background check requirements for youth over the age of 18 in resource homes. And so we had asked that that be something that could be an exception for youth who continue to be in foster care over the age of 18, whether they remain in that home or they're placed in a new home, maybe with siblings, that they don't have to go through a background check process as another adult in the home would have to go through. The legislature passed the legislation making the exception, except for when youth at the age of 18 or older move to a new foster home. And so this is going to be a change and a bit of a challenge for us to implement as we figure out youth rights to say no to having a background check. I don't know, Donna, if you want to say anything else about that piece, but it is going to be interesting. We're going to have a rulemaking process. It goes into effect January 1st. Love thoughts and feedback from this group and some of that process, but it is going to be different than something that our youth have ever experienced before if they are transitioning to a new or different foster home.
I think you summarized it
Okay.
quite well.
Okay.
Michelle, the only thing I'd add is we've asked our DOJ for some legal guidance on some of the questions that we have.
And maybe, Don, is it imperative to say this is actually like an FBI fingerprint background check? It's not just like us doing an internal review.
A LEDS check.
Yeah.
Or well, it's criminal history. So if there's LEDS and FBI. That's one of the questions I have for DOJ is, as it's written in the statute that it's written, could we do a LEDS check instead of the FBI fingerprint check? And not to bore everyone, so I won't. those are just very different processes. So.
And accessibility is very different for those depending on where you live as well. So
true.
Multiple things. The
the
legislature feels that, I mean, they made it very clear to me that there was a policy decision they knowingly were making. So yeah. Oh, Dean.
They move multiple homes. Will they have to get a background check upon each new placement after the age of 18?
Yes.
They can be in care till
That's how it's understood right now. I think it is contingent, Donna, on there being a minor in the home, but maybe not. I can't remember how the other adult in the home works, but
I mean, if we want to
this is pretty nuanced and
feel like
complicated.
criminals, this is a great opportunity to increase that feeling.
Can you say that again? Sorry, Pamela.
Oh, I said if they wanted to make foster youth already feel like criminals, this is just going to really up that, you know. That's really sad.
Yeah, so I have two questions, Michelle. The first one is quite simple. It's actually signing up for that thing that was just pasted into chat, the thing tomorrow. So I didn't hear too much of the first piece of legislation, the context regarding that. And the second thing is I'm just not as informed about you guys regarding the issues regarding background checks. So just like a brief understanding beyond obviously potentially feeling like a criminal. I'd just like to understand a little bit more. That's all. Thank you.
Yeah, and it might be helpful to come back to this group when we have more information from DOJ and how things might play out. But I think big picture, right now, DHS does not require youth in our care and custody to have a background check when they're over the age of 18 and they continue to live in a foster home or they move into a new foster home. We wanted to put that in statute and make that very clear that that's not a requirement. The legislature made their own policy change to that to require a background check when there is a youth who's over the age of 18 or older, I should say, and they are going to be moving into a foster home. And I believe there will be a minor child there where they could be considered an other adult in the home. And
just
I think,
to add to that, we have never interpreted current statute before 944 as requiring those type of checks. And our legislative counsel said, you looks like you're working outside of your scope in exempting these children, young adults. So that's where we're at. So to be clear, we have never required this or we're not actually doing it now. We were hopeful for a change in the statute. So like Michelle said, we're figuring out all those pieces and those questions that you all have. And so yeah, any feedback or thoughts is great. One of the things we've also inquired about is most of our young adults are represented. They have attorneys and notification or being required to at least be notified, but maybe consent. I don't know. This is new to me. So we're getting some feedback from DOJ and hopefully, like Michelle said, can come back with more information. Trying to be in compliance with the current and then the law that will be in effect January 1st.
Yep. And then there were a number of education bills passed. Some have more specific impact for youth experiencing child welfare, involved with child welfare. And then there's some that are just going to impact all of our kids, right? Because they're students in Oregon. But I would say, because there's so many multiple bills, I don't know if, Catherine, if you're able to send them your education guidance that you're going to send in August that's sent to all the staff. If you could send this group that same communication so they could be updated on some of those bills and impacts. Is Catherine still on?
I think Catherine had to sign off, but
okay.
Yes, in fact, she will be sharing her draft with the education subcommittee.
Oh, great.
Commission in, I believe, next month. And so that there can be some weighing in and some working on it together. And then, and that's before it's finalized.
Great. I'm glad this group will get to hear all that because there are a handful that I think are pretty important for our kids, and would be important for this commission to understand. And I'm glad that I can cut out kind of that chunk for this conversation so I can speed up here. So the last two are bills that actually did not pass. So, or they were, I'll step back. Senate Bill 875 and Senate Bill 736, there were specific reasons why the governor's office vetoed those specific policy bills. 875 is around the Foster Care Bill of Rights and Sibling Bill of Rights. And then Senate Bill 736 is around the CPS notification pamphlet. Now, I want to be clear that still in alignment with the veto, because the veto is specific to some key concerns around those bills as passed, that DHS is still going to be taking action on the things that were not of issue for the governor. So we are still looking at modification within our existing authority that does not need statutory change to update the Foster Care Bill of Rights and the Sibling Bill of Rights, as well as to make changes and adjustments to the CPS notification pamphlet. I specifically wanted to come talk with you all about this because I would love to get some engagement on some of the drafts that we've started right now for our, it's kind of like pre-rule advisory committee time. Like this is like kind of the community engagement with key partners before we present kind of here's the proposed rule and we have a formal rule advisory committee and start that whole process. So I'm curious if you're interested in both of those subjects or if there's one of those subjects that does like maybe, I don't know if the CPS pamphlet feels all that relevant to this group or not. I assume the Foster Care Bill of Rights is something you all would care about being the Foster Care Commission, but just want to make sure I'm not overstepping by sending too much or what have you.
I'm not sure I know what the notification pamphlet is. Did we?
Yeah, so when there is a Child Protective Service assessment, there is a pamphlet, and I'm happy to provide what is the current one. I'll drop it in the chat if I'm allowed to, of what currently parents or the, I would say, legal guardian is notified of for kind of the rights and process for a CPS assessment. And we got some feedback this legislative session on some adjustments that want to be made. There were some worries and concerns from our law enforcement partners and DA partners. And so we're all kind of trying to work together in this beginning before we have a RAC process of how do we all kind of get on the same page about what can be in this pamphlet that doesn't maybe assert that law enforcement will also have to comply with this because they have a whole different process for criminal investigations than what DHS needs to follow. So it's just getting the language right. I think there were some concerns around from, I believe it was Youth Rights and Justice, but don't quote me on that, but I believe it was from them around some of the language that we were encouraging parents to participate, like, kind of like, I don't know if cooperate was the right word, but kind of engage with the assessment, provide information. And there were some concerns that may not be the most appropriate. And then I think what ended up being actually passed in the bill was around DHS having to explicitly say we could not give legal advice. We're happy to say that. I think what we had debate about was to explicitly say we're not attorneys. And the reality is we have quite a few people that have a law degree that are a CPS worker. And so they want to be very clear that like they are not going to be acting as an attorney, right? But they don't want to be disingenuous by saying I'm not an attorney because technically they would be, right? And so they don't want to lie. So it's just having that and getting feedback. We're also sending this out to our Parent Advisory Council, trying to get feedback on the language and how the pamphlet is organized to make sure that it is can be received well. I think there's a lot of other ideas about how we could be communicating with parents and legal guardians. but this is kind of our first big step, is having heard from community that there could be some changes and doing what we can with an existing authority without having to have statutory change. Oh, Dean.
Yeah. So, what was the specific concerns regarding the the Youth Bill of Rights?
Yeah, there was an in terms of like what were advocates trying to pass, or why was it vetoed?
What was vetoed, and an explanation. So,
Michelle, I'm happy to jump in on
Sure,
this
go
one.
ahead.
So thank you for that. I do want to just make sure that we're clear, and we can share the veto message is public, so that is a public document that we can share. So you have the intent and the provision of that was in 875 that was really looking at the Foster Bill of Rights. We had no issues with that language. I just want to be clear. We support the Foster Youth Bill of Rights. We support the making sure that we continue to work with all of you. We have an administrative rule, the Foster Youth Bill of Rights. The concerns that we had was more, there was a separate provision in the bill that really was never talked about in the policy discussions that changed the definition of child in care, and it changes the legal definition of child in care, and then what actions and responsibilities for when the child abuse statutes and actions would need to be triggered. And that was the concern, because part of what we had been navigating throughout this entire session and policy discussions was making sure that we are looking and being clear, when is something a licensing violation and what are the appropriate actions that we need our child and care agencies to take versus when is something an abuse allegation. So when you looked at the language, when we looked at the changes under 875, it was changing the definition and expanding the definition to include any child in the legal or physical custody of DHS, including kids living at home with their parents during in-home safety plans or trial reunifications. The implications, because of how this was being added into the 418 citations, it meant that the law would make it so that the child abuse investigation framework, institutional level investigations, like for child caring agencies, would then be expanded to those parents' homes. So what that meant is that some of those definitions that we have in the child caring agency statute about involuntary seclusion, right? That's illegal. Well, what if you sent your child to your room? Is that involuntary seclusion? Because we don't regulate as a home versus a child caring agency. So the reason for the veto was based on the fundamental policy discussion that we need to have, and where the governor was noting we're not going to go backwards. We might not have made the changes we needed to do on HB 3835, but we're not going to add more confusion and add more populations into the child caring agency licensing rules that are more restrictive until we are really clear, is that really our intent? Do we want a parent's home to be treated and investigated like a child caring agency? That was really the policy reason for why.
All right, thank you. That makes a lot of logical sense, or else my mom would have been investigated. In fact, everyone's would have. So yeah.
And part of why we were asked, is if HB 3835 had gone into effect, then we would have remedied some of these concerns of 418. But since HB 3835 didn't go through, and then you have this bill that had a section that was making these changes, it triggered it to then to essentially have more populations be included in that child and care definition. And I want to acknowledge that's the similar concern for SB 736. It was the exact same issue. For the underlying reason wasn't about the concern. Like we support clarity, and we're absolutely happy to update a brochure, right? We will update a brochure, but this was a statutory direction to update a brochure. But what it did was it also then added changes into looking at expansion of who was included in that specific child and care definition. And so that just acknowledging the underlying reasons for the vetoes were not about the stated policy goals of the bills, right? It was about what was actually being done to the statutes and the underlying implications for then how DHS needs to regulate and oversee.
Casey, would it be appropriate? So I would love to get feedback from this group on kind of both of these proposed changes, and kind of what you will see is kind of some tracked changes to our rule language, and getting feedback from this group on that. For the pamphlet specifically, we do have the current version I just put in the chat. And then we have one that doesn't have like all the pretty graphics or formatting or anything, but it's just the text that we've changed. And we'll love to get feedback on how the rule then would look potentially in the pamphlet. For the foster care Bill of Rights, that would just, I think at this point, we would just be providing you with what the rule changes would look like, not necessarily the specific language in the Bill of Rights, because we do alter that to be developmentally appropriate for kids, and publication works with us on that. So this is really just kind of getting the kind of like meat and potatoes of like the policy conversations we're having, and then we can get feedback later on once we have something back from publications. But if that makes sense, Casey, I would love to send them to you, and then maybe you can get them out to this group, or I can send them to Ellen, whatever works best.
Yeah, I would send them to Ellen, and then she can get them out to everybody. But I always think it's appropriate if it's something that ODHS and the governor are working on. I think the commission would love to have an advisory role in it. And so, anytime there's something like that, I can't guarantee there's going to be somebody that wants to really engage on it, but sending it out gives them an opportunity to. So I think that's valuable.
Yeah, I hope to send that out either later today or early tomorrow, and be looking for feedback in early-ish August. So I know it's a bit of a quick turnaround, but we want to get initial feedback so that we can have our Rule Advisory Committee meeting in early September. So we're trying to meet all these deadlines to then have January 1st implementation, just like if it had passed, really trying to kind of meet with that same expectation, even though we're not statutorily mandated to do so.
Great. Well, thank you so much for that, Michelle. Always good to get a big legislative update. There was a lot of information at this meeting, so it was a really valuable meeting for me to kind of get up to date on what all is going on. At this point, we're ready to transition to public comment, so we'll go ahead and open it for public comment if anybody has anything to add.
Not really a public comment, though, Michelle, I did send you a PM regarding the first legislation, since I was signing up for that thing and I didn't fully hear about what that was. Oh, you're muted.
Thank you. The first legislation I talked about was the Critical Incident Review Team, and having court-appointed special advocates being a required invited party to those. Happy to talk with you, Dan, outside of this meeting if you want to know more information on that.
Of course. Do you have my information?
If you can drop it in the chat, maybe I'll reach out to you.
Yeah, I put it in the chat as well. So,
okay.
All right, thank you.
Great,
and
thanks.
that's essential. Thank you.
Okay, so next month, you'll see at the bottom of this month's agenda, we're going to have a discussion on the in-person for September or October. So I think we'll be kind of finalizing the dates for that. Other than that, if there's nothing else for today, we'll go ahead and close the meeting at 12:59 p.m.
Thanks, everybody.
Thank you.
Very productive meeting. Have a wonderful day.
You too.